today we'll go ahead and start the study session, and I think we have two portions. And Christine, I believe that you're doing both of them. The one is a quick update on the COVID, and then COVID-19 Therapeutics Liaison Program. So Christine, please move right ahead.
Perfect, thank you. I'll go ahead and reshare my screen. Okay, so hopefully that is up and running. Today I am here to present some COVID-19 data updates for both Jefferson County as well as the state of Colorado. And we will have an update on a program that is housed within our COVID activities in our infectious disease program. So this is the data that's available on the Jefferson County Public Health website. This data was last updated last Thursday. So we have maintained a steady to slightly increasing average hospitalization rate across the community. That's really good news. It means that the vaccination that we have and the level of immunity within our community is working to protect against the severe outcomes from COVID-19. Our positivity rate is higher than we want it to be. We are heading into a new wave of COVID-19. This is a surge that we saw start with our European partners on the other side of the ocean. We are seeing it in the East Coast of the United States, and our wastewater surveillance indicates that we are heading into a wave of COVID-19. So this is the trend over timeline. Hopefully you are very familiar with this document and this image as well. You can see the increasing trend. Information that we have heard from the state health department is the wave that we are entering into is expected to peak about the 3rd to 4th week of June. We will see rising case counts through there, and then we will start to subside heading into July. It's not anticipated that the wave should impact our hospitals the way it did during our primary Omicron surge. But there will be an impact on the hospitals, but they are not expressing concern about their ability to manage it, and they have the resources they need to be able to care for the patients that may end up in their care. This is the visual of the state of Colorado to kind of give you an idea of what's going on across the state. Jefferson County in the middle right here. We are in alignment with our metro partners, as well as some of our partners in Southwest Colorado. Yellow indicates that our case count for a week time frame, 7 days, is between 100 to 300, which is a pretty wide range. But it kind of shows that if you've watched this over time, we were all in blue with a smattering of green, and now we're kind of green, blue, yellow, and a little bit of orange. So this has changed as we are entering into our COVID-19 wave. This shows Colorado in comparison to the rest of the nation. We have been and probably will continue to sit in the middle when it comes to our reported case count. This is not unexpected. This is where we've been. The colors have changed. So as we've had more cases from this wave of Omicron, it's BA2.12.1. That's the variant of Omicron that is causing the wave. This is not unexpected. The colors have just changed. We used to be sitting in blue. Statewide, we hit green for a little while in March. This is not unexpected by any means. This number is pretty striking. It's estimated that 1 in every 108 to 149 Coloradans are infectious. This is a graph and data provided by the state health department. This number has been as low as 1 in 40 and as high as 1 in 250. So we're kind of sitting right in the middle. We're really low down here. Again, you can see this wave starting similar to Jeffco, similar to the state of Colorado. But you can look around a room and think, all right, 1 in 100 people sitting here, well, we're probably infectious for COVID-19. This is another visualization that you might not have seen. The gray bars indicate the percent of this age group that the overall Colorado population is. So it's a visual representation of how much that age takes up of the entire population of Colorado. The colored bars are how many of those people are infectious or are cases of COVID-19. And what this shows is there's a disproportionate level of COVID-19 cases among our 20 to 29-year-olds, our 30 to 39-year-olds. So that when the colored bar passes over the gray bar, that's where we get that disproportionate number. So this is one piece that we look at. This is cases. If you look at the mortality data, it is striking how many of our 80 plus population are disproportionately affected by death from COVID-19. Again, not unexpected, older population, harder to have an immune response, but it's also why our clinic team is really working very hard to make sure that that population is boosted for COVID-19 and has the information and the mitigation measures. It's also why the second half of my presentation about COVID therapeutics has become really, really important. How can we help someone in these older age categories and even the younger age categories, but really where those disproportionate numbers are, access treatment to have positive outcomes from a COVID-19 infection? This is our hospitalization graph. If you recall, I said we're slightly increasing, kind of maintaining steady. Nothing, we're watching it. That's what I would say. We're watching the hospitalization data. Nothing concerning, nothing alarming, nothing red flag. Statewide, similar number, up slightly from where we were in March. As of May 10th, there were 116 hospitalizations across the entire state. Very good data. This is a slightly updated picture, and I want to show this because if you recall, the hospitalization number on the JCPH website, which was updated last Thursday, was at 0.37. This data is through the 9th of February. So just a few days later, we've jumped up to 0.5. So just that slight increase in hospitalizations. Our case rate, on the other hand, was 164.5 last week when I got this very specialized report. It's up to 194. And why we're watching that is because the CDC, hopefully you've heard me say this before, has new community levels. This is how they are communicating to the public what they should do based upon the level of COVID in their community. Right now, we are sitting in community level low. This metric is a combination of new hospital admissions for COVID-19, the percent of beds occupied by COVID-19 patients, and our case rate. And if any of those kind of bump into the next metric level, so out of the green level and into the yellow level, then Jefferson County switches to community level yellow. This updates every Thursday. If you look at my previous slide where we moved in 1 week from 164 to 194, that tipping point for CDC community level yellow is 200 cases per 100,000. So I am anticipating, my EpiSense says that by Thursday, Jefferson County will be in CDC community level yellow. What that means is the recommendations for face covering and face coverings, masking and testing change. So really those right now, if individuals are vaccinated and unless they are not high risk, really it's, go about doing everything like we have been for the last several months. When we get to CDC community level yellow, that's where we need to take pause a little bit. And if we're at higher risk for COVID infections, if we're going to be interacting with a community member or with family, or working and interacting with a location that has high risk people for severe outcomes from a COVID infection, we might want to consider masking when we're in that particular indoor setting. So JCPH will message if and when we get to CDC community level yellow. There will be messaging that goes out with recommendations for our community as to what to do in this new level. There's obviously nothing magical between 194 and 205, but the CDC visual will change, and therefore we will provide recommendations to our community members based upon that information. So following up on that, my visual representation of that disproportionate level of mortality, the higher case rates that we are seeing, and other opportunities that we have had with case investigation and contact tracing, I wanted to present to you a program that we have stood up with 2 of our team members doing a lion's share of the work around treatments and therapeutics for COVID-19 infection. As you know, Jefferson County Public Health works to promote and protect the health of our community through prevention, education, treatment, response, and regulation. And our work involves with the COVID-19 response, linking people who are positive for COVID-19 with therapeutic treatments. So how can we improve their outcomes? Shorten their disease symptom period, lessen the likelihood that they end up hospitalized, definitely lessening the likelihood that they will become one of those mortality numbers. So we've created this program. We will always continue to advocate for vaccine and layered prevention as our #1 way to mitigate that spread. But should someone become sick, we have this opportunity to link our community members with information and potential therapeutic treatments. So the program was really stood up to provide information and resources, and we've been able to create documents that have been shared across the state. They have been presented to our statewide partners. We have worked side by side with our CDPHE colleagues under their therapeutic treatment team to make sure that we are aligning with the ever-changing guidance from our federal partners. And we have created a resource of information for people who have tested positive for COVID-19. So the way this program works is cases of COVID-19 continue to be interviewed by our team members here at JCPH. And during that interview process, our COVID staff and our disease investigators sort of screen and ask questions of that case to see if they would be interested in further information on the therapeutic treatments available. To step back a little bit, those therapeutic treatments are antivirals along with monoclonal antibodies, both proven to have positive outcomes from a COVID-19 infection. If the community member says, yes, please, I'm definitely interested, their information is sent over to the therapeutics team. And then our team, that therapeutics team, works to connect the community member with information and resources on how they can access therapeutic treatments. That has looked different as we've moved through the variants of COVID-19. When COVID-19, the variant aligned really well with the monoclonal antibody treatment, we were able to directly help individuals schedule for monoclonal treatments. That looks a little different now. We provide a lot more health education, a lot more information, and we do a lot of connecting of our community members who do not have health insurance or a primary care provider with telehealth providers who are able to help walk them through the assessment for the treatments that are available, and potentially write the prescription that might be needed to access those. One of those models is Test to Treat. This is a federal model. So there are locations available. You can find them on this website, but there are locations across the nation. There's locations in Jefferson County where members of our community can go if they start to develop symptoms of COVID-19. They can go, they can receive a test. If they test positive, they can be assessed for COVID-19 antiviral appropriateness, and then we can dispense those COVID-19. That location can provide them directly with the antivirals. So in one visit, they can receive the testing and then the subsequent treatment should they test positive. So this is one of the programs that our team has provided information on. The sort of sticky piece to this, I will say, the challenging piece is that you really need a medical provider involved because there's a prescription that has to be written, or there is insurance that has to be involved. So there's a lot of conversation, and if you have an opportunity as a Board of Health to interact with CDPHE or hear about the federal supports for those who are uninsured and provide the supports to that is really critical to the success of this Test to Treat program, the ability to access a medical provider and have the ability to pay for these treatments. So the results and the success of this program, in the past 3 months, this team of 2 has assisted more than 80 community members who have tested positive by answering questions, providing resources, scheduling appointments for them, and connecting them with providers so that they could receive therapeutic treatments. Again, that's either the antivirals or the monoclonal antibodies. Now, it's hard to say with these 80 community members have had positive outcomes with or without the therapeutic treatment. That question we can't answer, but we do know that we were able to assist 80 community members who likely otherwise would have had challenges navigating the system. In addition, our JCPH case investigation team has answered probably by this point thousands of questions regarding therapeutic treatments during the process of doing case investigation. JCPH has chosen to continue case investigation, even though it is not being required, because it gives us an opportunity to provide health information and connect our community members to these resources that may be valuable for them or contacts of theirs that they could have had. Hundreds of community members now have access to information and resources because JCPH has chosen to go this route with continuing our response to COVID-19 in this way. Woo. So healthy people, healthy places, right? That's our vision. JCPH is committed to supporting our community members who are navigating the challenging circumstances presented by the COVID-19 pandemic. We do this by identifying health problems and working to investigate and diagnose these concerns. We then work to inform, educate, and empower our community by linking people with needed health resources and services. The JCPH case investigation team and our COVID-19 therapeutics team are part of the foundation that supports healthy people living in healthy places in Jefferson County. So that's all I have for the presentation. I'm happy to take any questions or answer questions by email from the board. But I'm super proud of this team, and they continue to do amazing, groundbreaking, and pretty novel work.
Thank you, Christine. Do we have any questions? I know I have one. And it looks like, Harriet, you have a question as well. My question is, you mentioned if the board has a chance to reach out to CDPHE, what exactly would that look like? What would we be asking of them to do? Are they already partnering with each county? What is it that we would need to do?
Yeah, so this is part of the Colorado Roadmap to Recovery that was launched in late March. One of those 4 buckets was kind of the federal level policy changes. There's really minimal movement and information flow that relates to that. And I think CDPHE having a conversation with our federal partners is one thing, but if we can combine the entire voice of boards of health across the state of Colorado to layer in with CDPHE to really push our federal legislators to make movement on finding a solution for affordable, if not free, resources for our under-resourced communities when it comes to COVID-19 in terms of testing, therapeutics, treatment. I think we will be well served.
Thank you. Dr. Hall, you have a question.
Yeah, so my question has to do with the shift from the yellow to the green that we're anticipating. First of all, what are the recommendations when you're in the yellow, which I can't remember what it's called. Is that called medium risk or whatever?
Yeah, medium.
And so what are those recommendations? And then what are our plans for sharing that information with our community, hopefully with an eye to sharing it in the kind of positive way that it gets accepted and people actually act on it?
Right. I think one of the, we will do the social media push. We have a newsletter that is in the approval stages with our health communications team that will go out to elected and appointed officials. And if that change to the CDC level happens before that is sent, we'll just make a quick rapid adjustment. But there's a whole section that speaks to the community levels and what is meant by moving to level yellow. And for the members of the community and for the JCPH staff and for all of you, I would consider yellow as kind of the pause moment where we may not need to shift strategy at all, but we need to pause and think about what's my risk? What's my risk of a COVID infection and my risk of a poor outcome? And what's the risk of our community members around us? If I choose to go to a concert and I'm not high risk and I go and it's full of people and nobody's masked, but I know that the next day or the next week rather, I'm going to be going and visiting my grandparents who are in a long-term care facility. Well, that's that pause moment. Because while I may not be at high risk, I'm going to be visiting someone who's at high risk. So to me, being in level yellow is the pause moment. I think a little bit harder about do I want to wear a mask just to protect myself? And that's an individual choice. Or should I wear a mask because I'm going to be interacting with someone who I know is high risk? Or maybe I'm going into another large setting where I'm not quite sure who may be high risk. So I choose to wear a mask in that setting. So it really is the pause moment. It's like the stop way where, well, we probably should stop, but sometimes we blow through it and sometimes we don't. And we pause and we stop. The recommendations are to mask if you are high risk for severe outcomes from COVID-19, if you are in indoor setting, especially if you are unvaccinated and at high risk for complications.
Hilda, did you have a question? Okay, I couldn't tell if you were signaling me or if you were. Okay. Thank you. Board members, do you have other questions for this study session, the presentation from Christine? Well, thank you for all the good information, Christine, and all the diligent work that you and your team do. I know that you all have put in many, many hours through this whole last couple of years, so we appreciate you. Thank you. Okay, seeing no further questions on that, we will move right into our business meeting, and we will call the meeting to order. And just as soon as we call the meeting to order, I think probably we'll go ahead, since other people have signed on, and we'll go back through the, Lindsay, would you suggest going back to the language justice interpreters again, or do you think that enough people were signed on?
You could go over it again, or they could put the directions in the chat.
Yeah, that would be good. Let's do that. I want to make sure that just everybody has information that they need. And I think it is in the chat, so just go to our chat. With that, we will call the business portion of our meeting, the Jefferson County Public Health meeting to order, and it is 4:03. Lindsay, would you call the roll, please?
Sure. Hilda Gerke.
Present.
Harriet Hall.
Here.
Lane Drager.
Present.
Sherry John.
Here.
For the record, Kimberly Kropik is absent and a quorum has been established. Thanks.
Thank you. And of course, the first order of business that we have is the consent agenda. And as we look through that, we do the acceptance of the agenda, the approval of the April Board of Health meeting minutes, approval of warrants, approval of the contracts and agreements. And board members, I'll ask you if you have questions on any of the contracts, agreements, or anything that's in the consent agenda, would you just give me a shout so that we can pull that off? If there's questions, it was pretty simple, so I'm not sure there are any, but if we need to have discussion, I'll pull it off the agenda. Does anyone have a need to pull anything off? Okay, then I will ask for a motion to approve the consent agenda.
I would so move.
Second.
Okay, we have Dr. Hall moved it first, and Lane Drager, you made a second. Okay. With that, we would normally go to public comment, and my understanding is that no one has signed up for that. And as everyone knows, that the way that we have the meetings so that they're structured and we know exactly kind of time and how to get everything into the time slot, you will go to the website prior to the meetings and sign up if you want to speak. And everybody pretty much knows that now, but just wanted to make sure the public was aware of that. So with no public comment,
I think we still need to go back and vote on the consent. We had the motion in second. We just didn't do a vote.
Oh, we didn't do a vote. We did the motion. You're right. Lane, what would I do without you? Okay, Lindsay, let's have a vote on the consent agenda. In fact, we don't need to do that. I'll just ask for everybody, for all those in favor to please say aye.
Aye.
Aye. Aye. And any opposed to say nay. All right, that motion passes. Thank you, Lane. Okay, with no public comment, we'll move right into the financial report. And Salma, I'm assuming that you're going to be doing that.
Yes, I am. Good evening, everyone. Can you see my screen okay?
Yes.
Awesome, thank you. And I'll just move this. So today I will be presenting the April financial statements, and as of the current cycle and with 33% of the year complete, our total revenues are being reported at 31% of the annual budget, so 2% below budget. Grant revenues are being reported at 28%, while charges for services are being reported at 46%, so 13% ahead of the budget. As I mentioned during the previous reporting cycles, this is mainly due to restaurant licensing fees that are collected in advance during the first quarter of the year to support the retail food license program throughout the year. Salaries and benefits are being reported at 25% of the annual budget, so about 8% below prorated budget. However, please note that to date, this figure only accounts for eight pay periods. Coming July, we should see 15 pay periods, so an additional pay period which will balance actuals with the prorated budget at the time. So, and as expected for supplies and direct assistance, we are ahead and we continue to surpass the annual budget. This is mainly due to the fact that we've only budgeted $130,000 under both lines, and also due to some grant budget reallocations from other services and charges to these line items and some other factors. Capital projects and intergovernmental charges are slightly ahead of the budget, while interdepartmental charges are below budget by about 10%. These are cost allocation charges that are allocated to our fund by the county, and we are missing approximately $200,000 that the county should be allocating to our fund sometime this year.
Salma, I don't want to interrupt, but I need to ask you to slow down a little bit for the interpreters. They're really going crazy trying to keep up. So just slow down a teeny tiny little bit. Thank you.
Absolutely. So yeah, our interdepartmental charges are cost allocation charges, and to date, the county only allocated $430,000 instead of $630,000. So we are missing $200,000 of cost allocation charges. And to date, our total expenditures are being reported at 25%. However, if we account for the missing $200,000 of cost allocation, our budget would be at 35% of the annual budget. In terms of county transfer, to date, we've only utilized 14% of county transfer. You might have noticed during the previous reporting cycles that we've utilized 15% in March. This figure decreased because we've collected $830,000 of ARPA revenues, which did offset some of those expenditures that were previously offset by county transfer or covered through county transfer. So that's all I have today, unless if you have any questions.
Members, do you have any questions of Salma? Okay, thank you, Salma, for presenting.
Thank you.
I will move to approve the financial statement.
Second.
May I get a second? And Dr. Hall seconded it. Thank you. It will be approved and we will have a vote. All those in favor, please say aye.
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 Any opposed? Please say nay. Motion passes. So the budget has been approved.
Thank you for your time today.
Thank you, Salma. And now we will go to the senior leadership team and you get some updates and comments. And Jody, Erwin will have you lead us off.
Good afternoon. Thank you so much. First of all, I need to clear up the employee of the month and who's going to present that. I'm pretty tempted to do that myself unless Christine Billings had planned to do it. So Christine, were you on deck to talk a little bit about the employee of the month?
I am happy to give it to you, Jody.
Oh, thank you so much. So I don't even need to read the letter. Angel Anderson has been with us for a long, long time. And she's the employee of the month this month. She's somebody that I've worked with ever since I've been here. She is as amazing of a disease control epidemiologist, a co-worker, and a leader as you'll find in public health anywhere. Just amazing at her job. I remember many years ago when I first started in emergency preparedness here, the joke in public health is that things usually go downhill related to disease control after 3 o'clock on a Friday. And that's exactly what's happened multiple times, including one major outbreak where Angel was instrumental in helping track back a major salmonella outbreak to an egg distributor and was part of that. So she does an amazing job, has for many, many years. I'm thrilled that she's the employee of the month. She already got to go out to lunch with you. Those of you who could make the lunch this month, just congratulations, Angel, and keep up the good work, the great work.
Good job, Angel. Thank you. It was nice to meet you.
And you'll be getting a letter. You'll be getting a parking spot that I think you need to, oh, that's at the Parfait building though. So you got the lunch, you'll get the letter, and again, congratulations. So for my update, I'll do a quick update here in a second, but first I want to introduce Kelly Curl. And I didn't check to see if either of these folks are on the meeting. But Kelly comes to us from Larimer County, and she's our new policy specialist. So she's going to be working on really coordinating across our organization, our approach to tracking policies, working on policy from everything, food policy, tobacco policy, keeping track of what's going on in the state legislature, working with CalFO, working with MDPH, working with the county on everything related to policies. So when you get a chance to meet Kelly, and here in a few months, we hope to have her do a study session on the work that she's doing, but she's already doing great work. She's been here a couple of weeks. So welcome, Kelly. And then also, I'm not sure if Sierra is here to make this introduction, so I'm going to. Faro Palazzo has joined our health equity team, and he is one of 2 community engagement coordinators. He comes to us from Human Services, and I know he's been interested in moving to public health for a long time, just has a fantastic background in working directly with communities, and is now part of this kind of strategic approach and developing a strategic plan, I guess, for the health equity team, which also includes centering our communities in our work and coordinating that work across the county or across the department, similar to what Kelly's doing with policy and what Debbie Bauer is doing and Sierra is doing with health equity work. So welcome to Faro as well. For my update today, I wanted to talk a little bit about staffing. And as you know, we've had an incredible amount of turnover and change in the organization over the last probably 18 months. We have a big change coming up. Today is Kelly Conroy's last meeting with us after 10 years of being a key leader in this department. I was on her interview panel a long time ago, and just wanted to recognize Kelly for her work, her contributions to the county. So thank you, Kelly, for everything. We're definitely going to miss you. I just saw today that the 27th is officially your last day, and I know we've all tried to talk you out of it. So just thank you so much for everything you've done.
Thanks, Jody.
She's one of many who are leaving, and we continue to do a ton of recruiting. We have a lot of staff stepping into new roles, taking on more work. We have supervisors that in some cases have, I know at one point, I think Christine had 24 direct reports in the middle of COVID. I know I've had 20, we have several others that are in the same boat. And so to be in that position where you're kind of taking on the staff of other supervisors around you as they depart, and then trying to recruit for those leadership positions. And it's really challenging. Recruiting is just not, it's not an easy process. Also considering that the county implemented a new enterprise system for working through that process just over a year ago. They've been really good in being supportive of us. They've listened, they reach out to us all the time. Trying to help, understand what our needs are, but it's a long process. So continuing to do that while also balancing that with, the services that we're providing in the community, the strategic work that we're trying to do. And I know a lot of organizations are in the same boat. I think it's important to acknowledge anyway, even though this is going on around the country. So again, and I say it all the time, to those of you who have stayed, those of you who have joined us, thanks for bringing positive attitudes, exceptional work ethics, new ideas, new approaches to this organization. We definitely notice it. We do have challenges, but we're going to overcome those. And I reached out to, or actually I was on a meeting, I think, with Human Resources just a few weeks ago. And I thought that a recovery was coming soon as far as people coming back into the workforce. I figured it's probably this fall if COVID cases didn't go up. But they're convinced that it's going to be challenging for a long time to find people to apply for positions, that the workforce just isn't going to be coming back for quite some time. So we'll see where that goes. We'll keep you posted on those trends and what HR is saying and kind of what's going on with the recruiting. But on the bright side, for years, we've received feedback, even going all the way back to my days at Tri-County. The folks said, there's not a lot of opportunity for upward mobility in public health. Well, here's the chance to do it. Again, we're asking a lot of people to step into additional roles and taking on more responsibility. So this is an opportunity, I think, across not just Jefferson County public health, but public health in general. So it's time consuming, it's hard work. I just want to thank everybody who supported me and others through the recruiting process and that's taken on this extra work. And I think that's all I have today. Thank you.
Thank you, Jody. And I'll just go in the order that I have it, but please, if someone needs to go out of order, just give me a hand wave. Joe, I believe you're up next.
Good afternoon, everybody. I don't have anything urgent to report, and honestly, I think it's good for me to pass the time to someone else, as I believe we're going to be utilizing probably a significant portion of time during probably one of the follow-up Board of Health meetings as we start to develop the next year's budget and get ready to prepare that. But maybe at this time, it's good to give some credit to Salma and her team, who are putting in a tremendous amount of work, getting that process started, getting a lot of the information together to present something that is going to be a good representation of what the needs are for the department moving forward. So that's all I have for today. Thank you so much.
You know, Joe, I have to echo what you say. And I think that it would be great if the other board members also, and I'm sure they probably already are kind of watching to see what that budget process is going to look like, because it's going to be a sticky one. It is going to be sticky. I know that the county is looking at having to cut, what is it, Joe? Right now, I think we're hearing 20 million. Isn't that right? Obviously, that's not all.
That 20 million.
That's across the board, right?
That
we
is
don't even have 20 million. Yeah.
Well, that would be all of our budget.
Yeah.
You know, yes, that information has been readily available for quite some time.
Yeah.
There's been a lot of conversations that's been going on for over a year now, a couple years actually, and what the next couple years will look like. But it is still indeed a moving target, and that is one of the reasons why this year's development of the budget is going to be tremendously difficult, because we can plan for worst case scenario, but we're hopeful that there will be some more solutions to bridge that gap that we're all concerned about. Again, we're trying to find creative ways also to find savings and still support the department from one corner to the next. So it's like I said, it's a tremendous amount of work, but thank you for bringing attention to that, Sherry. I appreciate that.
Yeah, thank you, Joe. Okay, Elise, I believe you're up next.
Yeah, good evening. I have a few items to share. For the last 2 months, I represented public health at the Jeffco Thrives strategic planning sessions. That's Jeffco Public Schools. They're in the process of planning their next 3 years of strategy. They have 4 primary areas. And obviously, I was there representing the department and also trying to emphasize the relationship between health and education and health, and having learners and families and community members all involved in the process, and what we can do better. I brought up the point about the Board of Ed meeting more with the Board of Health, because we share a lot of common areas that by intentionally working more collaboratively together, maybe we could be more proactive. I had a chance, Hilda, to talk about school food. I know you raised that issue last month, so I conveyed that information. And some of the other topics, they're coming up with something that is very well-founded, thoughtful, the goals and objectives, and how they're doing the work. So more to come on that. They're just getting started, but I was very happy to be representing the department there. The second item I have is regarding WIC and the baby formula shortage that you've all heard about. And we do have 3 staff from that program. If they want to add anything to my very brief comments, but Colorado WIC is working with clients and WIC programs to try to secure, to loosen up product selection, to come up with some more innovation. But it's my appraisal is there's not too much, but people need to be patient and persevere and keep looking, work with their physicians. People are networking to try to find who may have more supplies. They're looking at, WIC is very precise in what they allow, different brands, sizes. ready to eat versus concentrate. So they're looking at waivers and ways to increase supply and availability of what limited product there is. So before I move on to tobacco, any of the registered dietitian supervisors want to add anything? I know that was very brief. If there's anything. Okay, Meredith. Okay, so I'll keep going. Okay, thank you. But yes, it's very, it's a very difficult situation. And I know some folks seem to come up with some really frivolous approaches to it, and it's a very serious problem. So we're working to try to make it easier for our clients. The last few items I have are all related to our tobacco program. You may have heard about the flavor ban being killed in committee. We think there may be, and I know I have sun coming through, but there may be some local jurisdictions who may be taking that up locally since it was killed statewide. Regarding unincorporated Jefferson County, the team will be doing some interviews to try to get more information from community members and stakeholders regarding what they understand and believe about retail licensing and expanding smoke and vapor-free public spaces. So you will be receiving invitations to participate in some of the community outreach as community members and Board of Health members. So please be looking out for that. Jeffco and Tri-County and Boulder County are working on a very interesting and innovative partnership to really look at the unintended consequences of tobacco policies and how they affect health disparate populations. And they're increasing their skills about that and looking at about how the practices can really contribute to making health disparities even worse. So a lot of times you're looking at flavor bans and how they affect youth initiation, but then there may be some other populations that if the teens were to get tickets, then there's legal involvement, which is, oh, we just wanted to help with cessation and limiting access, not to create a legal pathway because of the underage use of tobacco. So it gets complicated, and the team is learning much more about that. And then finally, working working with the schools to look at the vaping issue. Teachers have been reporting that the use of vaping products by teens has increased, and to look at different strategies to confront that. And they've been doing focus groups and meetings with teens to find out what their ideas are. And finally, regarding Gilpin County, it was discovered that there was a violation of the state laws, and our team worked with Gilpin County to make them become more in compliance. So that was one of those victories. So that's all I have. Any questions?
Oh, shut up. I really do appreciate you. Do we have a staff member trying to jump in? No. I do appreciate you bringing all of that up. And what I would also add is that if any of the board members, sometimes you have just certain things that just really hit your hot button that you really want, to kind of sit in meetings and participate more and find out more. As any of the directors and people, if you have those kinds of programs, like Elise, you just brought up 2 or 3 of them, get that information to me, because I can make sure that, I reach out to my fellow colleagues and see if there's somebody that is interested in, getting more information and sitting in on those. So Elise, thank you for bringing all of that up.
I know all the directors would enjoy that so much. So yes, please take advantage of what we can share. So
Well, you all
thank
have a lot of information that I certainly don't have. I know very little about all the stuff that you all do unless I sit down and talk to you. So thank you. It's been a real eye opener. Jim Rada, I believe you're next.
Thank you. I'll just report out on one thing for you tonight. The Jeffco Public Health is working closely with the Jefferson County Sustainability Commission on the development of the first ever Jefferson County Climate Action Plan. I think I've touched on this with the board in the past, but we have been involved or engaged with the Sustainability Commission for at least the last couple of years as they've developed their approach to climate action planning, developed the RFP, put out and then eventually has signed a contract with a consulting firm called the Brendel Group, who is assisting with the development of the climate action plan. The process is well underway. Jefferson County Public Health is very well represented in this effort. I sit on the project management committee that's working with a number of other county representatives from the county manager's office, county facilities management, and a number of other, and the Sustainability Commission, to make sure the project is advancing and that issues are being discussed and brought forward. There's a steering committee that's been created, and the steering committee meets for their second meeting next week. And Dr. Hall is on the steering committee with myself and with Debbie Bauer, our community engagement coordinator, Sierra Thompson, our health equity coordinator, and Kim Pineda, another special projects coordinator that works here at Jeffco Public Health. We are pretty much this group is the drivers. I should say we are part of the group that is the driver of the project. And there's been several focus groups already held with area subject matter experts on a variety of different impact areas that is exploring various types of approaches, ideas around solutions and actions and metrics to use in this plan in order to be able to create a very actionable, very equitable plan that is easy to measure, or as easy as possible to measure progress as we move forward. So the focus groups all met in the last month and a half. Steering committee meets next week for our second meeting to discuss the kind of results of the focus groups. And then we will enter into a community engagement time period from June through about September, maybe October. And our team has been very, very active in trying to help the consultants develop a community engagement plan that will really reach into the communities that we serve, the communities that we really want to get input and feedback from, to ensure that the plan that is developed ultimately by the end of this year really represents the needs, the issues of those disproportionately impacted communities in Jefferson County, and is as equitable as we can make it, at least as an entry into this this area of climate change and climate impact actions. So more will come with the community engagement portion of this effort will involve some open houses. There'll be community surveys. Our team is working very hard with the consultants to develop a survey that will be easily understood by many different types of populations across the county. We're very, very excited about being involved to that level. And then the open houses, certainly we hope that more of our board members will take interest in this action, and we'll make sure that you're aware of when these open houses and when the community surveys come out, so that you can not only participate, but perhaps you can influence some folks to in the community to participate at whatever level they feel most comfortable. So we're very excited about moving this forward. More information will be coming very soon on the community engagement front. And as I mentioned, we the intent and the ultimate deliverable of this climate action plan is set for the end of this year. So we hope that come the end of the year, we'll be discussing or beginning to discuss implementation and what that might look like, and how do we organize county staff and county resources in a way that actually helps the county implement or take steps towards the action items that are identified in the plan. And I just mention also that we are a funding partner in this project. A couple of years ago, we set aside $15,000 towards the project, which was very graciously accepted by the Sustainability Foundation's or the Sustainability Commission's foundation, which they created through Community First. So lots of pieces, moving parts, but things are moving forward, and we hope to have more information to you very soon.
Thank you, Jim. Are there any questions for Jim?
Hi, thank you, Sherry. Hi, Jim. Thank you for sharing all this information. I'm very looking forward to participate in those meetings. So please send the information and see which ones we can participate in, and like you say, by people to be able to attend to that. So I'm really excited to be able to get more information on that. So you can share it, that'd be great.
Excellent, I will.
Thank you.
Thank you, Hilda. Okay. Next we have, I'm almost sad to say, because it will be your last time to probably be able to speak with us, but Kelly Conroy, we are just going to miss you so incredibly much, but please share with us the information you have.
Thank you so much. I have a couple exciting announcements. One, I actually thought Jody was going to announce, but we did appoint an interim clinical services director this week. And I think she's on the phone, or I think she's on the line. Gwen Rodman Rice. She is currently our immunization supervisor. She's been with Jefferson County Public Health for 9 years. So I actually hired her 9 years ago. So she'll come with a wealth of knowledge and expertise to really kind of help move clinic services along. So congratulations to Gwen. We have also, well, we actually have one, we'll soon have a new advanced practice nurse supervisor. And I'm just waiting on the formalities of that right now, but that will be coming very shortly. And that individual will be over our sexual health and STI programs. And then Max Johnson, he has finally, he's been very patient, but he's been promoted into the HIV and the harm reduction supervisor program, two very important programs. So he'll be overseeing that work for us. So congratulations to Max as well.
And I apologize, I did have that on my list as an update, and then I wrote right before this meeting to let Kelly do this one. I forgot to let you know that I'm going to have you update about Gwen. But yeah, we're very, very excited to have Gwen on this team, and welcome, and thanks for that update.
Absolutely. And I was just a couple quick, I was actually, Gwen, if you're still on, I would let you give the updates for the COVID immunization updates. But I also wanted to add to that, with this kind of time of uncertainty around reproductive rights in the country, that I think this makes it even more important for our family planning and STI services. As we see other providers within the state who may see more individuals seeking out services that will increase the demand that they have on them with their limited resources. And we anticipate that we may see additional individuals coming to us to seek sexual health services. So I think it's just a really important time, and we'll kind of keep an eye on that and make sure we're still able to provide those really important services in our country, in our county. So when, oh, there you are. Did you want to give a brief update on the COVID immunization pieces?
Sure. I just thank you very much for everything, Kelly. I don't have any words for you leaving, so or you're going to be greatly missed around here. But in regard to COVID, I just wanted to let everyone know that we are continuing our walk-in clinic at the Parfait location. We have that Monday through Thursday. We have all vaccines available, and we're providing first, second, third booster doses for everyone. We are also continuing to work with our community partners for outreach clinics, and we're just working with the individual community partners on what works best for their communities and how to best serve everyone. But just letting you all know that that is still going on, and we're actively working to find those populations for not only the booster doses, but we're still seeking out those primary and secondary doses of people that we haven't touched yet. So.
Thank you, Gwen.
And I just wanted to thank all of you, Board of Health and the SLT, for all of your support and mentoring. You'll all be greatly missed. Thank you.
Well, we are all going to miss you a lot, but we wish you absolutely the best. They're lucky to get you over there, to have you. And I'm not even sure the whole board knows where you've gone to. So you might share that with them.
I've moved to Northwest Arkansas. So
yeah, that's quite the move, don't you think, y'all? Y'all. I don't even know if they say that over there, but well, Kelly, thank you for all of your years of service. How many years were you with Jefferson County?
10 years.
Yeah.
Yeah. And the SLT team has been so supportive and welcoming, and I can't say enough about how important the work is and the collaboration that we've had over the past couple months. So,
well, you've been such a big part of that. Thank you. Next, we have Carrie. Carrie, you're up.
Good afternoon. I do have a few updates today, and Kelly, I want to take the opportunity to say thank you for all the ways that you've supported me, and I appreciate our clinic services so much, and all the ways we've referred clients to the services that you've provided. So thank you. I'm going to miss you a lot. So I wanted to just highlight some of the work that's being done in the Family Services Division. Our staff member, Cynthia Farrar, representing Jefferson Public Health for the Alliance for HPV Colorado, statewide initiative to increase the uptake of the HPV vaccine, provided training for 60 medical providers and metro area clinic staff, including some of our own clinic staff in the last month. The HPV 101 and motivational interview trainings were provided virtually and in person for 5 different clinic sites. So that was a big accomplishment, and we appreciate the work that Cynthia does. She also is our regional health connector. I wanted to mention Sophie West, who sits on our child fatality review, but also works in injury and violence prevention, initiated a project with some of our ARPA funds to access and distribute gun safes. So she's partnering with Jefferson Center for Mental Health, and they have acquired, and I'm going to get the number wrong because I don't have it in front of me. I can't remember if it's 100 or 300 gun safes to get those distributed to keep lethal means in a safe place. So that was a great project that came to fruition, and I believe those are being just delivered this week. And another part that was cool about that was when they were looking for who to purchase the gun safes with, they were able to do that with a local business. So another partnership with Jefferson County Public Health and our local businesses. We have Oriana Richmond, who is working with Teens for Social Justice. And they just recently, one of their projects was they put together a zine, a publication representing those LGBT youth voices, their concerns, their artwork, and a community building project of that work together. Another really important thing that came to fruition after years of planning and preparation was the Cuenta Conmigo Lactation Training. Angelica Pereira provided a 6-day lactation training to Spanish-speaking participants. This is more statewide, not just within Jefferson County. So she has been working with multiple counties, and the training took place in Weld County. But this is something that took about 3 years to have happen. We've never had a Spanish-speaking lactation training. That's not been available in Colorado before. And it was an intensive 6-day training that she brought to fruition. I'm hoping she gets to continue this lactation support. And as was pointed out earlier by Elise with the infant formula shortage, breastfeeding and lactation support is always important, and it's important right now particularly. So I just really want to acknowledge the work that Angelica did. She is definitely a leader here in Jefferson County Public Health and is doing some really innovative work. Mary Margaret Foose Bishop and myself have been working in partnership with Jeffco Human Services to lift a new program called Family Connects. It's an evidence-based nurse program, a nurse visitation program for the postpartum period. We are recipients of a starter grant for the planning part, but we are in partnership with Denver and Boulder as demonstration sites for Family Connects. The program is a universal visitation program. All families, all postpartum families are eligible for it. So the idea is that all birthing families would have the opportunity for a nurse home visit 3 weeks postpartum, where nurse could just assess the health of parent and baby and really be the bridge to other home visiting services or mental health services or anything that that family might need in that child's early life. That's a really, it can be a vulnerable time, but it can also be the time for opportunities where parents are really open and if they need support, to have somebody who is available to all parents to be that bridge. So that program is called Family Connects. I hope to be continuing to update you on the progress we are making because it's a big lift. We're working on what the catchment area is. Boulder is already bringing this to fruition. They're a little bit ahead of Denver and Jeffco. Denver and Jeffco are partnering together. Our hope is that we will house those nurses here at the health department, at least for the initial phase. And while we have a grant that's funding this planning period, we still are looking to blend and braid funding sources to support the full implementation of the program. So you'll be hearing more about Family Connects. Finally, I just want to mention also that I've been sitting on representing JCPH at the Bright Futures Roadmap as one of the co-chairs. One of the things that the work that's ahead of us right now is identifying a local coordinating organization for our catchment area of Jeffco, Gilpin, and Clear Creek County for bringing universal pre-K to this area, and who is going to be that local coordinating organization and where is that work going to live. So nothing has been decided, but we want to make sure that all the right voices are in the room, and that there is representation for all 3 counties. So whether that is housed, whether the executive director for that and the coordinator will sit within Bright Futures, like in another organization such as Jeffco Public Schools or Triad, our Early Childhood Council. This is what we're looking at to figure out what is the right local coordinating organization. So I don't have an update on what that's going to be or where that's going to be yet, but that's another place that I'm sitting to represent the health department right now. Those are the updates from Family Services, and it's great to see you all.
Well, it's not like you haven't had anything to do. And we appreciate you being there too. Thank you for keeping us posted on all of that. I do appreciate it.
Yeah, we do have,
and the board does.
Well, we do also have some turnover with some nurses, and we're looking at as we're kind of taking it slow for our rehires, because we want to see if we're like with the Family Connects coming and some of the other work, our structure may look a little different, our teams may look a little different. So we're trying to be thoughtful and intentional within our division of how we go forward and what our staffing is going to look like.
Yeah, very wise, very wise. Board members, any questions for Carrie?
I do, Cherry.
Hilda has a question.
Yes, well, thank you so much for all your updates, Carrie, and for the hard work. And I'm just sorry, I have enough feedback in my ears. I just have a question, a curiosity more than anything. You mentioned the training about the breastfeeding, and it was Angelica's project, and it took like 3 years in order to make it a reality. Can you tell us a little bit about what were some of the barriers for the team to take along to be happening it, and what support your team needs to make sure that continues, that training continues?
Actually, I don't think I can speak to that very well, because I wasn't even aware that this training was happening until just recently. And so I've just been learning myself a little bit about the background that led up to this. I'm so excited that I really wanted to highlight it. But you ask an excellent question, Hilda, as far as what did take so long, or what was happening to bring this to fruition. I know that for a CLC, a certified lactation consultant, what I learned today from Angelica is, I believe she said that that training and certification, there hasn't been any trainings provided only for Spanish speakers with that certification. So even with this training she provided, which is all of the same material. So part of it was, yes, I can remember, it took like 3 years to have all of the materials translated into Spanish and to prepare. So that alone, I think, because I don't think that was any one person's full-time job working on that. I think this work was started years ago by staff who are no longer here. Paulina Arisis, I think, started some of this work. So I think between the work being started by staff members who are no longer here, COVID happening and the translation time, those are things that are coming to my mind. There may be other things that moved it forward or held it back that I can't really speak to. But what I can say is that I really think that many of us see the value in it and want that work to continue forward and hopefully to grow stronger, and to be able to not just provide the training information, but to make sure that that certification is available to. And it looks like Kelsey Rivera may be able to speak to this more. Her hand is up. So Kelsey, please jump in.
Yes, thank you. Sorry. The main thing being that it was like a train the trainer course that Angelica did. And so she had to complete the course herself, in addition to all those pieces that Carrie mentioned with the transcreation of the curriculum. And then like the staff turnover and some of those other pieces. But so, yeah, Angelica had to complete the train the trainer program as well, and then was able to teach it in Spanish for anybody who wants to take then the CLC exam, but maybe would not be comfortable learning in the English language.
Thanks for providing that, that other piece of it, Kelsey. I appreciate that.
Thank you.
Yes, thank you, Carrie and Kelsey.
Okay, and Christine, it looks like you're up again. Do you have something that you would like to add? Some more stuff that you all have been working on?
Yeah, I think real fast, I will add to the other half of my division, the Emergency Preparedness Division. We have been supporting a handful of resource mobilization efforts. We have partnered with the county, Jefferson County, as they work and establish a all hazards warehouse for the county, of which Jefferson County Public Health will have a large cache of supplies available within there for us to respond to any hazard. We learned and benefited from holding on to and having a cache of masks when we started our response to COVID-19. But in there, we will also have our infant and young child feeding and emergencies support kits that we are able to get out to community members. Allison Wilson is still hard at work on that program. We have received from our partners in New Orleans several hundred individual family kits that we will be able to hand out to families ahead of a disaster so that they are prepared should something happen in the community as it relates to infant and young child feeding. And along with the CLC class in Spanish, we have partnered with the Rocky Mountain Medical Reserve Corps and our community member, Miss Lucy Dakota. And we have, Lucy is helping our Reserve Corps translate the incident command system basic training into Spanish. It is not available in culturally appropriate Spanish language, and that is changing. And I'm very, very excited about that, so that our volunteers will be able to support the whole of our community in a disaster when it comes to infant and young child feeding. So that is pretty groundbreaking and pretty amazing. And I have met with the FEMA regional administrator and really kind of pushed FEMA to really adopt strategies and represent themselves and address their strategic plan to include equity and diversity inclusion, as we are all working very humbly to do within JCPH and across Jefferson County.
Thank you, Christine. Any questions there? Okay. And are there any staff comments? Anyone that from the staff? I know several staff members have signed in. Are there any comments that That's because all these directors were pretty doggone thorough, weren't they? Okay. Board of Health comments. Do we have Board of Health comments? Lane.
I think first, just really want to thank Kelly. Again, it is such a loss for our community, but a gain for the community in Arkansas. So I'm very happy for you. And again, so thank you so much for all you've done for this community and for the years of service. I also wanted to just, again, shout out to all the programs. It's so wonderful to hear from all the directors. The Communities That Care is one that I always, again, I'm so amazed by our community as well as the staff that are involved, but I was able to join those youth voices and see the videos and the work that the youth have been doing. And so it's so refreshing and it's so encouraging to see these future leaders and just the efforts and anything that we can do to augment that program. I would love to see things like that in every single high school, every single even middle school in our entire county. I think what they've done in the schools that they've been able to work is just so wonderful. And for the community to hear more about that, I don't think they're getting enough attention. So, continue to, I know our communication folks do an amazing job, but, continue to highlight the efforts of all these amazing programs so that our community knows. It's sad to me that we don't see the same level of participation in our meetings to hear all these wonderful things that are happening in the community now that people are not able to come and complain about having to wear masks, which sadly people really should start to do again. And hopefully we don't have to entertain orders and things like that. But again, I'm so happy and pleased to see all the efforts and privileged to be in this community.
Thanks, Lane. Dr. Hall.
So I want to echo Lane in the thank yous to Kelly and best wishes in Arkansas to you. And echo that it's wonderful to have the time to hear the details about, from all our various programs. It's very impressive, all of the things that we do. So thanks to all of you for your hard work and for your very cogent reports that we've gotten. I do want to comment a little bit on COVID and the information we got in the study session at the beginning. The number of 1 in every 108 to 149 in Colorado have COVID. I was in the UK when I think the number was 1 in 13. And I got COVID. It's hard to avoid unless you're shut down with masks like we used to be, and we probably won't be now. I don't look forward to going through that again. But I just want folks to know that that's what happens in the wave. If our wave is like the wave in the UK, why it's kind of nasty, even though the seriousness of this current variant seems to be not nearly as bad. So that's all. This is all very personal to me now, the COVID stuff. So I'm watching it closely.
Hilda?
Oh, yes, thank you, Sherry. Well, I just want to second what Lane and Harriet mentioned. I'm really impressed with everybody's report. I think it's just showcase how much everyone care and how hard everybody's working on this different projects. I was also part of the community the care presentation, and I was very happily impressed with how much talent it was showcased. And I agree, we should be able to do it in every single school, because I know there is talent everywhere. And I'm really looking forward to hear more about the other programs that you guys are working on, Family Connects, and some of the programs that Elise was mentioning. And thank you, Elise, for following up with one of those concerns with the food. I appreciate that. I'm really just so proud of being part of Jeffco, and I hope more community members understand the hard work that public health does in every single area. So looking forward to continue supporting them, and let's work on that budget to make sure it happens. Thank you, Cherry, and thank you, everyone.
Thank you, Hilda. And Kim, I think that you have had something, but one of the things that I wanted to say was it's so nice to see that we're able to jump back in again and sit down and start meeting with some of the directors and all the incredible things that they're doing, and for all of us to work together on how do we get that message out to the public. Because, you know, as the comments have been made, and Lane, that you just even made the same comment, the public really has no idea the expertise and the stuff that Jefferson County works on, and the incredible programs and stuff that we do have. And I think it's really important. And Jim, I know that you all, and with Dr. Hall and the team and all the other people that you mentioned, being able to go out into the communities and bringing together some of those town halls and getting the education out there. So I'm really excited that we're in the phase where we can all start doing that again, because there's certain things that, you know, catch your ear as you're listening to all of you talk about the programs that you have. And I know that the directors love it when a board member jumps in, you know, to sit and listen and to be a part of that. So thank you to all of the directors. And Kelly, we can't say it enough. You know that we're all going to miss you, and you've just done such an incredible job. And we just wish you the very, very, very best in Arkansas. Kim, I believe I saw you unmute, I saw you turn your little camera on, have something to share with us.
Yes, thank you. I wanted to introduce Carrie Markle. She is the newest member of the county attorney team. She is a member of the leadership team. Her title is Deputy County Attorney, and she's in charge of the transactional team. So she took over Courtney Hartman's position. We are thrilled that Carrie has joined us. I've personally known Carrie for about 20 years. We practiced way back when together at a firm here in Denver. But for the past 15 years of her career, she has been in state and local government, including at the Attorney General's office, and most recently at the South Carolina Supreme Court. So we are thrilled for her to join us, and she's here with us right now.
I am thrilled to be here, Kim, and to join your wonderful team.
Well, we're happy to have you. I'm sure that we'll give you a lot to help educate us on.
I look forward to that.
Yeah, thank you. And thank you, Kim.
All right, thank you.
And the other thing that I wanted to mention, and Lindsay, help me because I don't have the dates in front of me. We're very excited at how the Employee of the Month luncheons are going. We just can't thank the employees of the county enough, of the public health department. So we're thrilled with how those are going. And Lindsay, help me out here. The next date of the next one, it's the 29th? Help me.
4th.
The 24th?
Yep, next week.
Well, that's next week. It's next Tuesday.
Yeah.
It's on my calendar. I can't remember the dates. And we are catching up with all the folks that weren't able because of the shutdown, you know, with everything during COVID. So we're going back and inviting those Employee of the Months for that particular month too. And then the other thing that I know has come up a few times, and I know as I talk to board members, when they talk about thanking the employees, because you can't ever thank them enough. One of the things that I noticed was how many employees would say, yeah, I don't ever get to meet everybody. And I'm like, oh, that is just wrong. You know, how can you not meet people in your division? And so one of the things that the board is also sponsoring is per division kind of doing a meet and greet. And so I know that we have those beginning where people can actually just come from that division and get to know each other and thank each other for the work and stuff that they're doing. And we want the divisions to know how much the board appreciates all of those workers. So when is that? Have we made the final decision, Lindsay, on when?
There's 3 scheduled, just 2, excuse me, 2 more need to be scheduled, but the 3 that are scheduled are in June. So on different dates, and I can just email those to the Board of Health in case you guys want to drop by.
That would be great. I think Elise has one of the massive time slots I saw. She's making use of all of the time that she's got. But yeah, I would encourage board members to just show up. It's fun to go to the Employee of the Month meetings and just sit and listen and watch the employees interact and to thank the employees of the month for the work that they do. And that's all I have. Does anyone have anything else? Any board members have any further comments, or staff, or Lindsay, did I forget anything?
I don't think so. You did great.
Oh, thanks. All right. Well, there you go. At 5:07 p.m., we can say that this Board of Health meeting will now adjourn. And thank you all so much for taking time to attend, and have a wonderful rest of the week.
Thank you. You too. Have a good
Thank you. Thank you.